Our government has today vowed that the sanctions fixed in the imposition of restrictions law to contain COVID-19 will be enforced to the letter. Information Minister Kojo Nkrumah said the security agencies have been directed to deal with any person found breaching those directives. This comes in the wake of concerns and allegations that some officers have beaten up citizens who have disobeyed the directives, even though sometimes some of them are expected to be on the list of exemptions. Mr. Nkrumah and Head of Police Prosecutions for Greater Accra, ACP Donko, have been speaking on the matter at a news conference.
Now, the Constitution of the Republic gives all of us a number of liberties. But because of the current situation in which we have had to take measures. Excellency, the President has had to take measures in the interest of the country to suspend some of our liberties and to impose restrictions. These suspensions and impositions had to be done in accordance with law. And so you will recall that right from his earlier broadcast, he mentioned that he was instructing some ministers to get either some legislations passed or some executive instruments issued and gazetted. We just want to give an update for the avoidance of doubt this morning. The declaration of public health emergency for COVID-19 pandemic, Executive Instrument 61, is currently in force. It was gazetted on the 23rd of March under the signature of the Minister for Health, the Honorable Kweku Agyeman, Member of Parliament, and it is pursuant to subsection 1 of Section 169 of Act 851. So the Public Health Act, Act 851, which gives him the power to declare a public health emergency, and based on that declaration, also now quarantine persons, which would ordinarily be against that person's liberties, is in force. And so we want to encourage for our colleagues, if it becomes necessary that you are asked to either self-isolate or to be put in a quarantine facility, there are laws that back it. Shortly, I'll show you some of the sanctions if we also do not comply. At this point in time, we're asking everybody to comply with authorities. But this is for the avoidance of doubt. EI 61 is now in force. It is what gives us the power to quarantine persons who have tested positive, and also to restrict their liberties while we are supporting them with treatment. The President also asked for the enactment of an act known as the Imposition of Restrictions Act. As I'm sure you have followed, Parliament has enacted that. The President has gazetted that as well. It is that act that gives the broad framework for the imposition of further restrictions on the broader Ghanaian population. To do that, the President has had to issue two different executive instruments. EI 64, which was gazetted also on the 23rd of March 2020 under the signature of His Excellency the President Nana Addo Dankwa Akufo-Addo, and EI 65, which is the latest that imposes the restrictions on Greater Accra and Greater Kumasi, gazetted on the 30th of March under the signature of the President of the Republic, Nana Addo Dankwa Akufo-Addo. These two are available. We'll give you copies, colleagues, so that you can also, as part of education, make it available to the general public.
As the Minister for Information earlier today, with that breakdown, well, let's take a look at the current case count for Ghana.
As of now, we have about 200 cases confirmed across the country, and a total of about 49 patients with COVID-19 have been discharged for home care. As mentioned in the last conference, we have added 2 more facilities in Greater Accra to provide care because a large number of cases are in Accra. So I'll give you a breakdown of where that is in the Bank of Ghana and the University of Ghana Medical Center. Let me give you a breakdown of what's happening in Ghana East, which is the largest center currently now. Currently, we have 58 people on admission. Yesterday, we admitted 2 new people. There are 3 of them who are getting oxygen, and we are informed that they are getting better. A total of 38 has been discharged for home care, and we are following them on a daily basis with home visits, and they are actively getting better. Ridge Hospital has 4 cases. They are all there, been there between, they've had a case since between 13 and 19 days. We are waiting till the 21st day. I mean, as you are reached 21 days, and then you are retested, and if you are negative, then you are discharged. At the 37 Military Hospital, 1 case is on admission, and they are also managing 6 cases at home. They have an excellent facility with a 20-bed treatment center with 4 ICUs available on ventilators for people who need care. The home care, 20 of the 20 screening are waiting repeat. Of those who are at home, the home care, the 49 I mentioned, about 20 are waiting, retesting, and if they are negative, then they will be discharged. And now, as we said the last time, 2 people have already tested negative and they have been discharged. That has declared cured. Kumasi has no case, and the only 1 case they have qualified for home care, so it's being managed from home. Konfanochi has a case, 1 case on admission, and repeat test was negative, and then positive, and then we have also put him on treatment to see how it goes. Obuasi has 2 cases, and they are all being managed at home. So far, 12 contacts of the second case has been followed. The first one had about 30 contacts, which have been followed. And while we have 1 case on home care, Tamale has 10 cases. They are stable on treatment. 7 of them are still managed from the hotel where they are, and 2 are in the hospitals. Eastern region has 1 case reported and awaiting more information. Either they'll be managed at home or be transferred to the hospital. But currently, they are being managed at Atua Hospital for further management. UEGMC, as we said, is complete with 5 ICUs and 14 beds, and they are ready for use. In terms of case management, there's been a lot of capacity building. They have a bus at their disposal for their home care, etc. We have given them 3 pickups so that doctors can visit people at home and provide the necessary care. Currently, today, people will be trained on how to use the ventilators in the ambulances to manage care should they need be, and that is going to take place this morning.
Well, from day one, one of the major concerns has been the use or the availability of PPEs. And on front line here on the Pulse, we've had several conversations about this. Well, the issue came up strongly at today's press conference. Listen.
PPEs remain a major challenge for all of us. And I think it's not just Ghana, but it's a global challenge. We continue to provide as many as can be pushed and put in this, and then more continues coming in. We have received a significant number of coveralls that is being distributed today, and some masks last night, which is being distributed. But these are definitely not going to be enough, and so we urge facility heads to ensure appropriate distribution of the masks. Generally, majority of our people will just need masks, nose masks, and gloves. And that's what we're going for more than 98% of all health workers. We want to ensure that that's available. We've started the process of having some local production of one, and what I'm wearing is a local production that is comfortable, it can be washed and re-ironed. I think this is something we want to promote. We want to encourage all people to wear masks if you can, especially those who have flu-like symptoms, to wear masks. But the problem should wear their own masks to ensure that these things are done. So a lot more is being done to push more PPEs into the system. And there are plans to provide local production to boost what we are bringing in currently. Ladies and gentlemen, the contact tracing, I think today is the 5th or so day since we started. We are testing all contacts in Accra, in Kumasi, and across the country, and do their contacts and for them. We are testing all people we meet in their homes. We have hotspots where we visit, like Tamale, contact tracing is being done. Our contact tracing is being done. Currently, we are looking at about 110 contacts in Eastern region who are being tested, and then the report will be shared as and when they come in. As at yesterday, over 6,000 samples have been taken for testing. So testing currently ongoing across the country. That's at 6 p.m. yesterday. We also are looking at the quarantine patients who were negative and still in the hotels. We so far completed 7 hotels. We've done tests for 538 of them. And then once the results are ready, we are hoping that within the next day, today and probably by end of tomorrow, all the tests would have been done and the results will be shared with all people in the hotel. Then preparation for discharge will be done based on, or management will be done based on the results that we have. We will continue to follow up contacts. And we plead with all Ghanaians to support. So far, reports from the field show there's a lot of encouragement, and that once they do a house, they are encouraged to look at the area where the positive is, to test people to see whether is there any community spread, to give us a gauge as to what is really happening. We gauge and treat all to support and encourage them. People were asking for identification. District directors have given them some notification to show that there are really people who are there sent by the service to offer doses. Those who are positive, we are continuing to provide them psychosocial support across the country. Psychologists have been engaged to talk to all those who are positive and negative and brief them on the next steps of what to do. And we also entreat all to abide by the quarantine rules that have been shared with them to save themselves, their loved ones, and all of us.
So what's the latest on contact tracing? That is also an issue that was addressed at the press conference today.
From the beginning, we had mentioned that we're doing contacts of all those who are contacts. We'll come to their homes and we'll do the periphery around the area where you are, but it's not compulsory. It's voluntary, where they could do to test for other possible community transmission. When you have a community that may have a lot of positives, that tends to be quite intensive and see a lot of tracing going on around your community. But we've not had similar problems in other places. And so it depends on how it is. And as we continue testing, as new tests become positive, their contacts will be traced. And so the intensity will depend on how many positives are in the area. But like we said, it is voluntary, but it's in our own interest to ensure that we get tested. There are people who are asking to be tested, and if they fall within the parameter, we test them.